Okay.
Okay, so again, thank you everybody for being here. I wanted to give you a little background in terms of the goals, and Heather asked a question while we were waiting for folks to join, which is helpful for me in explaining to you, in addition to what Tanya has said, why this is important. So the purpose of this webinar today is to give you the basic information about the renewal process that is happening now. And as we'll talk about, the state is now renewing all families that are enrolled in Medicaid. It started with people getting a notice in December, and that will continue through people getting a notice in March. And we're going to talk about what the notices look like. The goal is to help your clients complete renewal. So you're going to learn how to help a client identify when their renewal packet will be coming to them, how to read the renewal material so that if somebody says, "What is this notice about?" you just have some basic understanding about that, and then how to refer people for help. So Heather's question was about kids who are in DCYF care and for whom you have contracts from DCYF. Those, if they're in DCYF care, they're not being renewed right now. However, the parents may also be getting right care and their renewal is happening, or they might have a sibling who's at home who's not in DCYF care and their renewal will be happening. So even, I assume that as you're working with kids who were in DCYF care, that you're also working with the whole family. So I'm hoping that this will help you understand how to ensure that the other family members are able to successfully complete renewal. Does that make sense to folks? Okay, here we go. Here we go, I hope. Ooh. Okay, so just as some background, usually Medicaid recipients need to renew their coverage once a year. But during the pandemic, renewals were stopped or suspended so that people didn't lose their critical health insurance coverage. In April, the Center for Medicaid and Medicare Services, CMS, required the states to begin Medicaid renewals again. So the state started with elderly and people with disabilities and people aged 19 to 64 to begin their renewal process in April. And every month there's been a cohort of people who have received renewal materials. The state calls this the return to normal operations, or as Karen referred to it, unwinding. The renewals for households with children started in December to renew by the end of this month, by the end of January, and this will continue through March to renew by the end of April. People who are enrolled in SSI, so if you have a kid or a parent who's getting SSI benefits, they automatically receive Medicaid and they are not subject to renewal. And as I mentioned, if a child is in DCYF care and that's how they have Medicaid, they're not subject to renewal either. So this is just because I get confused about the cohorts and when things need to happen. So right now, there are families that received a renewal notices in December, and they have to complete their renewal by end of January to be able to keep coverage in February. And then you can see each cohort coming up. So here, I'm going to talk about ways that you can help the family know that their renewal is happening, because it could be in 1 of 4 months, right? But the state has set up a website, this quick lookup tool, and you have the link here, and we'll obviously send you the slides so that you can just click on these live links. If you're working with a family and you're asking them, did you get your renewal materials, or your renewal is going to happen, do you know when you're going to get your papers? You could just help them click on this link. They need to know their Medicaid ID number, which is on their white anchor card. And then you could tell them when they should be looking to get the papers in the mail. So the date that you'll see in the website is the date of the renewal month, but the month in which the packet will come is the month before, right? So just going back to this, if you went online for the renewal month and it said February for Linda's family, they would have received their renewal materials in January. It doesn't say that on the website, but now you know. Oop, going backwards. So that's a first thing to do, is to help the family understand when they should be looking for their renewal packet. So now we're going to talk about what the renewal packet might look like. And there are sort of three situations. One is that some people are automatically renewed, sometimes called passive renewal or administrative renewal or the happy path. Because if everything that the state looks at its databases and looks at so Social Security database and the Department of Labor and Training database to see about wages. And if the state has enough information about the family, they don't have to ask the family to provide any information. They will just renew those members automatically. So far, for the single adults and elder disabled, there's been around a 50% renewal rate. And it's anticipated, at least EOHHS says, that for the children, the administrative renewal rate will be between 80 and 90%. And in part, that's because the income limit for kids is so high that many kids are eligible. And as long as the state knows about the parents' income, they'll be able to renew them. So there's a yellow packet that comes. I mean, the notice is in yellow. And if what's inside says the people listed below will be automatically renewed for Medicaid, you'll see the names of the individuals that will automatically be renewed. And so let's say a client calls you and said, I just got this yellow paper, what'll I do? You can look at that and say, well, read me what's at the top. And if it says will be automatically renewed, everything's great. You can say to them, just read through the papers. If anything is not correct, write in the correct information and return it. And I'll talk about where to return the papers in a little bit. So the second news, or the second type of renewal, is active renewal. And there it will say action required, review the information we have on file for you. What the family should do then is read through the document, make sure to sign it. It's on page 9 or 10 of the document, and return it within 30 days of the date at the top of the notice. And definitely to try to return by the 10th of the next month. Now, because, previously the renewals were going to single adults or generally to elderly or disabled individuals or sometimes couples, but now we've got the parent and the children being renewed. So as you probably know, and I'll show you the income limits in a bit, the income limit for children is much higher than the income limit for kids. So in this example, a family of 2 has income of $4,000 a month. The parent is not going to be eligible for Medicaid, and we'll talk about their eligibility for other health insurance through the health insurance exchange. But the child is going to be eligible because the income limit for the parent is $2,317. The income limit for the child is $4,317. So in this case, the notice that the parent gets, and I didn't have a yellow one of this, so that's why it's in white, but it will be in yellow, is telling us that action is required, but and this is going to be the parent, right? That the parent has to provide information, but the people listed below will be automatically renewed, and these will be the children. Okay, so again, mixed because of income differentiation. The way this would have happened is when the pandemic started, a parent maybe lost their job and their health insurance covered through their job. So they applied for Right Care. And based on their unemployment income, they were eligible for Right Care along with their children. But during the pandemic, or between 2020 and now, 2024, the parent got a new job and they now have coverage through their employer or their income went up. The parent stayed on Right Care until this renewal time. And again, that's going back to the idea that the government wanted people not to lose their health insurance coverage, even if they had income changes during the pandemic. All right, so now as they're being renewed, the state is catching up, looking at the family's income, and now making a determination about whether the parent and child are still eligible, maybe just the children because of the higher income limit, but the parent's coverage may change. And I see there's a number of, are there questions to answer in the chat or just people signing in?
No, just people
Signing in.
to Tanya's request to put their name and email in the chat.
Okay, thanks.
There was a
I'll
question
just put
from me about if the kids are passively renewed, but parents are actively renewed, do they get separate renewal notices or all in one? And you already answered that.
right. So they'll get one notice. And I'll just say that these notices are not the model of clarity. So I should mention that if the family has indicated that Spanish or Portuguese is their primary language, they will get their renewal notice in that language. But the English language version to me is sort of unintelligible. And the Spanish and Portuguese ones will be similarly unintelligible. And I'll give you some more examples. But the main thing here again is to look at when it's a mixed, right? It's the simple administrative renewal, the action required, and then the combination of it'll say action required, but in fact, if you read down, you can see that the children are going to be automatically renewed. So if the family doesn't send this renewal form back in, the kids will stay on, but the parent will go off.
Let's pause and just make sure if there are any questions from the group, and you can use your raise hand reaction and that'll make you pop up for me if you have a question for Linda. Okay, no questions, so we'll continue.
Okay, great. So this is the process in pictures. So you have the big picture of what's going to happen. So the renewal notice, the yellow notice, will come in an envelope that's white, that is marked time sensitive, open immediately. And there's a window where the person will be able to see that there's a yellow document, a yellow colored document inside. So that's what you want to advise your clients to look for. Don't, we know that sometimes people just put this in a pile or toss it out or whatever. You want to tell your clients, look for this envelope that's going to come, look for the yellow window. It's important so that you can keep your Medicaid coverage. So let's say either both the kids and the parents needed to have active renewal, or maybe it's the kids are going to be auto renewed, but the parents are actively renewed. They will get another envelope, which will also be marked time sensitive, open immediately, telling them what additional documents they need to submit. And that's called an ADR, additional documentation required. So the family that is not Happy Path, everybody's auto renewed, should watch for this additional letter to come in the mail and then follow the instructions on the letter about what documents to send in.
So these are two separate envelopes that come in the mail. The yellow one alerting them that they're either active or passive or a mix. And then a second document for additional requesting the information that's needed by DHS.
Right.
Okay.
So then DHS, well, it's actually, it says EOHHS or Health Source RI. It doesn't actually say DHS on the envelope. So after the initial renewal papers are sent, then the state will send a notice in the beginning of the second month. So this for the families that were sent a renewal form in January, they will get this notice in February. If the state hasn't received the family's materials and they need to submit something, they'll get a letter in the mail saying, please submit your Medicaid renewal packet. If they've sent everything in, the state will also send something acknowledging that the materials have come in. And it is the Department of Human Services, or DHS, that does all of this work. The notice probably still comes from EOHHS/Health Source RI. And the reason the state wants is sending this out to tell people they're all set, just wait for a decision, is to prevent people from calling the contact center asking, did you get my materials? Did you get my materials? Not an unreasonable question. So hopefully this stops them from needing to make those calls.
And that's
Okay.
important, right, Linda? Because the call center line is getting sort of clogged up, right? With people making those calls to check whether or not their information has arrived.
Well, the DHS call center is a lot of issues. I don't really know if people are calling for that, but as I'm going to talk about, families who have questions about their Medicaid renewal should be calling the Health Source RI call center and not the DHS call center. So we'll talk a little bit more about that. But getting that notice, your documents are here, just wait for us to make a decision, gives the person comfort that nothing is going to change in their coverage until the state gets through those documents. So I've talked about submitting the renewal form, the yellow form, and then documents that the state may ask them to send in. So there's a couple of ways to do it. There are now 3 scanning centers that people can bring their documents to. Doesn't help folks down in the southern part of the state that much, but in the Providence, Pawtucket area, documents can be brought to Reservoir Avenue. These are all DHS offices on Reservoir Avenue, Roosevelt Avenue, and Holden Street. That's the new DHS office. If people can do this, especially if they're coming up against the time deadline for submitting the documents, this is a really easy and secure way to ensure that DHS has the information that's needed. Somebody could walk into a DHS office. So you could walk into the Newport office or the South County office and bring in the materials. Another good way to do it, but I strongly recommend that if somebody is dropping documents off at the DHS office, to ask for a receipt for the documents that they're submitting. The third way is to mail to DHS. And if documents are being sent, don't send the original, make copies. And the documents are usually mailed after the person gets that ADR form that says, we're missing your income information. They want to make sure to send page 4 of the ADR, which has a code on it, so that the information that they're mailing in is linked to their case. I would say that a typical where we might see people needing to submit income information are those who are self-employed. And so that the state cannot be checking with the wage information from the state. They have to see information from the individual, from their tax documents from last year. So that's a group of people who are self-employed, are people who may be subject to having to send in their information. there is people who are on Medicaid also have a customer portal. They can use a customer portal to access their account, and they can upload their documents through their customer account or through on their phone through a mobile app. I'm not thinking so much that all of you may be helping your clients do this, but you should know this is possible. And I'm going to talk in a little bit about where you can refer your clients for help. I see Annie Cortez, you have a question?
Yes, good morning. Linda, so for the drop off of documents, do they have to go to their local office or okay.
Oh, no, good question. No, people can go to any DHS office. So if you're working with somebody who can say they're in Woonsocket, and instead of going to the Woonsocket DHS office to drop off the documents, if they want to go to the scanning center, they can go to any of the Providence or Pawtucket scanning centers if they can get there.
And does that apply for if it's not a scanning situation, they just want to drop it off? And I'm
Yeah.
asking, okay, because
Yeah,
we
they
do
can.
have homeless families and they're
Mhm.
just, Warwick but they're, like you said, it's more convenient. Maybe they're working or their
Right,
relatives are in a different city.
right.
So, okay,
So
that's good
they
to
should be
know.
able to go to any DHS office. And again, I urge people to get a receipt just to make,
Mhm.
so that we know that the documents were received. If somebody goes to a DHS office and is told you can't drop that off here, they should call me. That's just wrong.
Okay,
Okay?
thank you.
Sure. Okay, so now we've got, watch for the renewal papers that come in the envelope where you can see the yellow renewal document inside. Then the next piece of information would be the additional documentation requirement notice if people still need to submit additional information. And then then they get we got your information or we didn't, please send it in. And now the fourth processing pictures is going to be what happens. Are they, for the people who were not automatically renewed, are they still going to be eligible for Medicaid? And that's what this notice will tell them. This notice will come for the people who were renewed in December, got the renewal packet in December. Right around now, they are going to be getting this benefit decision notice if they are not automatically renewed. And so the benefit decision notice will say, again, not a model of clarity. This on the first page says health coverage, your health coverage is being renewed. Then the second page says, there has been a change. I'm looking for where it says that. There has been a change to your eligibility for health coverage. Well, in this case, there hasn't because their Medicaid is renewed. Okay, so obviously confusing, but as long as it says here, your health coverage is being renewed, and it says here the type of coverage is Medicaid, they're okay. Got that? However, there are people who will get a notice that says you're not being renewed. This will say your health coverage is changing, which is really a little misleading because it's really the case that their Medicaid is ending. But so you could, I'm going over here. Their Medicaid, if the person looks on the second page, they will see that their Magi Medicaid, so their Medicaid is closed, and it says your application has been denied. Of course, this isn't an application, it's a renewal, just so you'll know we keep working with the state to make their language better. But this person, and we're going to talk now about a good thing that the state put in place, is that if you think of health insurance coverage being Medicaid and then buying commercial coverage through Health Source RI with tax credits, that's sort of the range of subsidized health insurance coverage that people can get. So the state has set up that some people who are close to Medicaid coverage in this process are going to be automatically enrolled in a qualified health plan from HealthSource RI. So that's what this information is, where it says type of assistance or coverage at the top. This person is going to get private health insurance, and cost sharing reduction is part of the assistance that's provided to people with certain income when they buy coverage through HealthSource RI, as is the advanced premium tax credit. So we'll talk about that in a minute. So note that this benefit decision notice, let's say it's a family that's self-employed. So the state couldn't determine the eligibility of the kids because they don't have income information, or of the parents. But once they get that information, the parent may be ineligible because the income, remember, the income limit is lower for the parents. The information the state now has tells us that the parent is not eligible, but the children still are. So this notice of the benefit decision notice may include the kids are eligible, but the parents are not. Okay, so this is what I was starting to talk about, that we think about health insurance coverage as being this continuum of income is low enough to get Medicaid, or if the income is above the Medicaid limit, then there's the opportunity to buy coverage through HealthSource RI. People are eligible for that if they don't have coverage through their employer, and they can get help paying their monthly premium from the federal government because they get advanced premium tax credits. But also the state put in place, at least during this unwinding period, that if the person's income is less than 2 times the poverty level, they will be automatically enrolled in a neighborhood health plan, and their monthly premium will be paid by the state for 2 months. If their income is between 200% and 250% of poverty, then they need to sign up on their own through HealthSource RI, but the state will pay their monthly premium for 2 months. So here's the income chart for the different twice poverty and the kids' income limit versus the parent income limit. So I'm going to spend a little time with this. I also just want to note here, as it says, the income limits increase in January. The notice of the increased income limits, or its increase in the federal poverty level, have just been released. It may take a month or two before the state puts this into effect, but generally the income limits in all of these monthly amounts is about $200 higher than what you see in this chart. So let's talk about some examples to try to make this real. So we have Juan and his daughter Jen, who are receiving Medicaid. They enrolled in May 2020 after Juan lost his job. He went back to work in January 2022, earning $4,000 a month, but he stayed on Medicaid even though his income is higher, right? At renewal, Jen will stay in Medicaid because they're a family of 2. So the Medicaid limit, or the right care limit for a child, is $43.71, but Juan is no longer going to be eligible for Medicaid because his income is above the $23.17, but and he will be able to enroll in a qualified health plan if he doesn't have insurance from his company, and have the state pay his first 2 months of premium. Here's Riva with 2 children, Tasha and Kyla. At renewal eligibility. So this is one area that's going to be tricky is that when a child turns 19, they're no longer a child for purposes of Medicaid. They're now a single adult. So at renewal, the eligibility for Kyla, who's 19, and will be, I'm sorry, the eligibility for Riva and Tasha, because Riva is still a parent, will be measured against the the Medicaid income limit. For Tasha's will be the 40, I'm sorry, it's now two people, 4371, and for her mom, Riva, the 2317. But Kyla, who's now 19, is a Medicaid adult. And so her income limit is going to be 2268. She may also be eligible automatically for to be enrolled in a qualified health plan, right? Because her income is lower than 3287. And then the last example, Tom and Terry are married and have a son, Mickey. Mickey turned 19 in November, sorry. Mickey turned 19 in November, and at renewal, all three of them are now treated as single adults. So it's the MA income limit that applies to all three of them. Tom and Terry are two people, they're a couple, so their income limit is 2268, and for Mickey, it's 1678. Again, they may be automatically enrolled in a QHP and receive the federal assistance to pay their premium, and they may also be eligible for the state premium assistance and auto enrollment. So an issue in my head has been that around the 19-year-olds, and sometimes if there's a child who's 19, if there's another child in the family, then that child and the parent will still be eligible based on the family income limits. But if the last child in the family turns 19, then the parents are no longer parents, they're single adults. So that's the point of having gone through these examples. And again, to relate it to the families you're working with, the family size, even if a child is in DCYF care, you know what, I have to look at what the family size is for that configuration. So what is the eligibility limit if one child is in DCYF care and mom and a child are at home? So I will get back to you all on that. So I know this is maybe a little bit overwhelming. Any questions at this point? Okay, we'll keep going. I also wanted to highlight families in which some of the family, it's usually the situation where the parent is undocumented and the child is a citizen. It can also be a situation where the families all members have a green card, but the children are eligible right away when they have a green card, and the parents have to wait 5 years. So this is the brief summary of immigrant eligibility for Medicaid. All children, regardless of status, are eligible for Medicaid if their family income is within the limits. This includes children who are undocumented. That was enacted 2 years ago. And there have been a lot of undocumented kids who have gained coverage as a result of advocacy by Kids Count, Protect Our Healthcare, and the Immigrant Coalition. So we now cover all kids, regardless of status. The other types of status they may be in are green cards, lawful permanent residents. They don't have the 5-year waiting period, refugees, people granted asylum, and a number of other categories. But basically in your head, think kids eligible, the end. Parents and adults, a little bit more complicated. If they have a green card, they have to be in status for 5 years. If they are refugees or person granted asylum, they're eligible. And like children, pregnant persons are eligible regardless of their status. So 3 things important to know. A parent can apply for coverage for their eligible child and would only need to provide their income, but not any other information about themselves. And that's applicable at renewal as well. You all may know or remember that during the Trump administration, there was a lot of anti-immigrant rhetoric, and there were restrictions on eligibility for a number of public benefits. And that made many immigrants lawfully here and otherwise fearful of applying for benefits to which they or their children were entitled. And this is commonly referred to as the chilling effect. So for example, some people who were lawful permanent residents who had a green card, even though the child was eligible for Medicaid, the parents wouldn't apply because they were afraid it would impact something about their immigration status, which it would not. But the rhetoric was so severe that parents just feared applying for the benefits that they were entitled to. So I just want to put a pin in thinking about if you're working with any families where the child is undocumented, or the parents have, the whole family has green cards, or any family in which everybody is not a citizen, just pay attention to the fact that we want to encourage people to apply for their children and or themselves, and they shouldn't have any fear that it will impact their immigration status. So we had good news of the auto renewal, right, where people don't have to do anything. And a little bit more good news is that after this return to normal is completed, where everybody is being renewed, right, then first of all, in the month that they are renewed now, that will be the renewal month a year from now. So we're going back to renewals once a year. But changes can happen during the year. Let's say the family's renewed as of February 1. Between February 1, 2024 and 25, maybe the parent gets a different job and starts to earn more money. That can impact the parent's eligibility during that year. But for that first year, the children are all going to be continuously enrolled in Medicaid and not have to have renewal. So let's say during the year between 2024 and 2025, parents' income increases, it would make the child ineligible for right care because the income goes up so much. The child will still maintain coverage. So that's a way of ensuring that kids don't have a break in coverage during a 1-year period. Kids Count and partners, including Protect Our Healthcare, are looking to pass legislation this year that would provide continuous coverage for young children up to their 6th birthday, so they would not have to go through renewal once a year until they turn 6. And that will help children avoid gaps in coverage that happen at renewal, because we know that many families don't return their renewal packet. They lose their coverage. It's called churn when they lose coverage and come back on. So we're getting the data to show that we can avoid that churn and breaks in coverage for kids if we exempt them from having to do renewal until their 6th birthday. So this just some tips. I mean, we sort of talked about this as we've gone through the presentation. How can you help the families keep coverage? Number one, and you may have seen a lot of information about this from the state, make sure that the families with whom you work have up-to-date contact information with the state. They can call HealthSource RI and give them their updated information. They can call their managed care plan and give their updated mailing address. That's the first critical thing, to make sure the mailing address is up to date, because they will be getting all these materials through the mail. Then you could work with the family to look up the month in which their renewal packet will be coming. So remember that the date the packet will come is the month before the date in the lookup portal. But that would be very helpful. So you could say, hey, Karen, you know, you're going to get a renewal packet. Let's look it up. The renewal packet, the renewal date, I'm sorry, on the lookup portal, it says that your renewal date is March. Watch for your renewal packet in February, the month before. And then if you can, you could keep track of the date the renewal packet will come, give the family a call in the month that it's supposed to come in, maybe put a note on the family's fridge or ask them to put a note to remind them to look for that renewal packet. Look for the white envelope that has the yellow materials inside. So you could check in with them in the renewal month. You could say, hey, pull out your paper. What does it say? And if it says the happy path of administrative renewal, right? You know now how to read that. Ask them to read the top of the yellow notice. If it says you don't need to do it. Administrative renewal, they're all set. If it says it's an active renewal, you need to take action. Advise them what they need to do. And again, remember that for some families on that notice, you need to read down the notice because some of the kids will be auto-renewed, but the parents will need to submit information. And again, we're not expecting that you will do this help for folks other than help them understand the next steps, but there are community assisters who can help them. There are certified application counselors, there are navigators. You can click on this link to help find a navigator or certified application counselor. They might be able to get some help from their managed care organization. They could call the managed care organization which number is on the back of their card and see if they can get some help there. I'll just briefly point out, which doesn't say here, the certified application counselors can help with the renewal process, but they can't help people understand which health plan they might want to enroll in through HealthSource RI. Only the navigators can do that. So if people have questions about which plan to enroll in, they should call a navigator. And then again, I want to emphasize, and Karen referenced that the DHS call center is very backed up. Since all of these families are enrolled through what's called the Magi coverage, they can call the HealthSource RI call center for help. They should not call the DHS call center because they'll wait and wait, but at HealthSource RI, it should be much quicker. So another great resource is the Ripen. They have a call center. And if people, if you're working with somebody who says, I just don't understand what this says, it's very confusing, or they're telling me my adult child is no longer eligible, or it's a child who was enrolled in SSI but lost their SSI coverage, call Ripen and they can help explain the notice and explain the next steps. Okay, so what happens? So now let's say that there are families right now who are getting notices saying their Medicaid will end because they didn't complete their renewal. If they submit the renewal form and documents by the end of this month, so that would mean going to a DHS office and saying, hi, I'm here, here's my information, or going to the scan center, or even mailing them in, the family should be reinstated to coverage while DHS works the case, and they should be reinstated to their managed care organization. So it's really important if somebody calls and says, I just got this notice, they're stopping my Medicaid, what do I do? Get your renewal form and documents as soon as possible. If it's after the renewal month, so the people who are going to get a notice in January, they're cut off, they failed to do anything, and they realize that their coverage has ended because they go to the doctor or they look for some Medicaid, they look for some prescription coverage, say February 15th, and the pharmacist says, sorry, you're not covered anymore. You lost your Medicaid. They have 90 days from the date on the top of the notice form to get in their renewal form and their documents, and their coverage, if they're still eligible, will go back to the date that their coverage stopped. Let's say the person gets a benefit determination notice today, and it says they're no longer eligible for Medicaid. And they think that's wrong. The state got their income information wrong, or something has changed recently. They can file an appeal and request a hearing. If the appeal is filed within 35 days of the date on the benefit determination notice, which is the date at the top, then the termination should not take place, or benefits should be restored until there's a hearing. There's an appeal form in the pages of the benefit determination notice, so they can use that form. They can bring it into the DHS office and have it scanned, or they could bring it in and drop it off. Again, get a receipt. The person doesn't have to repay benefits they received while the request for hearing was pending if they lose the hearing. And generally, the best advice is if somebody gets a benefit determination notice saying their coverage is stopping and they think it's wrong, they should call Ripon or Rhode Island Legal Services for help deciding whether or not they should file an appeal. And then they may have representation from one of those organizations at the hearing. So this is a lot. Where can I get more information? Karen has talked about the Protect Our Healthcare Coalition. If people go on the website, there's the helper handbook. There's an appeals fact sheet, which actually we're making a few changes to at the moment. People can sign up for updates on coverage and more information. You can get involved in advocacy if you're interested in doing that. And then the state maintains a website, which is statecoveredri.gov. They have fact sheets in many languages. They have examples of the notices. That's where I took the pictures of the yellow notices. They have the list of community helpers and a lot more information. So that's it. Oop. And here we are back in person. Any questions that folks have or situations you've run into? Often, I find in doing these webinars that people may be shy about asking a question because they think, oh, that question's just too, it's too stupid. There's no stupid question. As you can imagine, this stuff is, it can be complicated to understand. Annie?
Hi, Linda. So I don't know if you mentioned this, and I apologize if I just missed the information. I want to go back to the youth that turned 19.
Yeah.
So you're saying that during the renewal, they turn 19, they're automatically enrolled into insurance, or they're not enrolled and they have to enroll as single.
Well, they should, as long as if the state has enough information about a 19-year-old, and a typical example would be the family is getting SNAP benefits. A child, I use the word child, a young adult living with their parent cannot get SNAP benefits separately from their parent until they turn 22. So the state has the information about both the 19-year-old, because they're in the SNAP case, and the parents and other children in that family. In that case, the state, as long as they have the information about the 19-year-old, they should be able to decide whether that 19-year-old is still eligible for Medicaid because their income is low enough, or might be eligible for a qualified health plan through HealthSource RI. I'm not 100% sure that that's how that's working. We have asked, keep saying to the state, this is what you should do, but they may not be doing that automatically. And then the 19-year-old may need to apply separately, in which, and it's simple to do that. They can go to a navigator, they can go online and apply at the HealthSource RI website, or they can call HealthSource RI on the phone and they'll do a phone application with them. But putting a pin in the kids that turn 19, I think is important, because there may be a lot of families in which the young adult turned 19 between 2020 and current.
Right, and even for myself, I probably I don't do this work often with families, but it's good to have the information. For me, 19-year-olds, oftentimes they live with their parents, they're
Right.
dependents. So I wouldn't
Right.
have thought, that they would be considered.
Right, but
And-
their status for health and it gets a little more complicated in terms of whether the parents still declare them as a tax dependent. So I'm not going to get into those details, but just watch for the families in which there is a 19-year-old where they may get in, and actually they get a green notice as opposed to a yellow notice where their status may change. But again, in that case, just advise the person to call a navigator or I would call Health Source RI as sort of the first line of attack because it might be the easiest to get through there.
Okay.
Tanya's
you.
hand is up.
Yep.
Yeah, sorry about my cat. My understanding is that if a child has ever been in foster care, however, and they're 19, then they're automatically eligible till they're 26. Or,
If they
or do they
exited,
have to be at their 19th birthday?
no, thank you for raising that. So if a young adult exited foster care, then if the young adult was in DCYF custody or was in foster care and exited, they're eligible for Medicaid coverage until they turn 26. So there shouldn't be any break in coverage for them.
And I think that might be true. It says former foster youth. So they might even, if they were in care from 16 to 18, now they're home at 19, do we know whether they would still be eligible?
No, they have to have exit. Oh, God. I have to go back and double check. I will double check.
Yeah, my understanding of this is that if the child leaves foster care before aging out, they go back home or they are, adopted, that their coverage reverts to their guardian and
Well,
no longer carry their Medicaid till the age of 26. That's my understanding, that they have to essentially have aged into 19 while in foster care in order to maintain their Medicaid coverage under the state till they're 26, the state being their parent.
yeah, I will write something up about this. I mean, I think that's, so if a child was in foster care from 13 to 15 and they go home after that, they're just regular right care, right, with their parents.
Right.
And so let me just write up some of that stuff for you because there's different iterations, it seems like.
Yeah, that would be super helpful. Thank you.
Okay. Other questions? Okay. Well, I appreciate all of you participating and
And I would just say that if any of you, one of the things that Linda has really been trying to do in partnership with Protect Our Healthcare is to monitor any seemingly systemic issues that are going on. So if you begin to see families that, wow, I've seen 3 families where this mistake has been made in their Medicaid determination. Please alert us. Tanya will be sending materials out. Linda's email is included. Tanya, you can include my email as well, or even just alert Tanya so she can call it to our attention. If you are seeing the same mistake or problem happening within your constituency base, alert us so that we can do the due diligence of advocating with the state to correct the problem.
yeah, and I would say, as things are going wrong for individuals, referring them to Ripen and their call center is a really good thing to do. Like, don't wait till you see a pattern because they're also Seamus Durak, who is at Ripen, is the chair of the Protect Our Healthcare, and we work closely in terms of trying to identify systemic issues and dealing with them with the state. I'm always happy to answer a question if people have questions. So you can send me an email with that.
And Ripen is a member of our coalition as well. So
Right.
folks hopefully have some kind of a relationship. So We cannot thank you both enough, and thanks everyone for taking the time to jump on today. I think it's really important information that we get out there. And we can't assume that just because the child we work with, is in DCOF care, that their Medicaid issues are resolved for them and their family. So this is so important. Thank you.